Thanks for staying with us here on the Wellness Beat. We're back with Dr. Tamu Davidson. She is Director of Non-Communicable Diseases and Injury Prevention inside of the Ministry of Health and Wellness. We're going to be talking with Dr. Davidson about the resources for cancer screening available inside of the public health system. Earlier we talked with Kediesha, who shared her story of being diagnosed with breast cancer at age 30. Welcome to the show, Dr. Davidson.
Thank you. It's certainly a pleasure to be here to talk about such an important topic that affects every single Jamaican.
Right, and the figures, Doc, are startling, both in terms of cancer cases and deaths. But what I think may be shocking for those who are listening or looking on, nearly half of cancer deaths are preventable?
Yes, so based on what we know now, and about cancer and what can be done, we know that there are lifestyle related things like your diet, your nutrition, which is a great contributor, obesity. We know things like also exposure to certain environmental factors can increase your risk for cancer. But most importantly is that many of the common cancers, and for Jamaica, the most common cancers amongst women, it's breast, followed by corpus uteri, that's uterus, and cervical cancer, and colorectal cancer are some of the common cancers. Okay. When we look at men, the common cancers are prostate, colorectal cancer, and lung cancer are some common cancers. And so we know that these cancers can be, we can screen for these cancers or implement early diagnostic testing in order to prevent persons from dying from these cancers. And our data shows that cancer is increasing, and the concern is that we're seeing more and more younger persons die. Yes. So dying prematurely within the age group 30 to 70 years old, meaning that this is your most productive aspect of your society. And we know that cancer doesn't just affect the individual, yes. It is the family, the society, and very often many of these persons are the breadwinners or central to the family themselves. So a diagnosis of cancer brings in everyone and the entire family.
Right, touching across all points of society, yes. the family unit or productivity or economy and so on.
But I want to say that you can get cancer at any age. And one of the things we know, as we also looked at childhood cancer, yes. In February, was that 80% of childhood cancers can be survived. And we know that the majority of these cancers that are being survived, children are surviving from these cancers once you make the diagnosis. So prevention, not heavily emphasis in that group, but making that early diagnosis and getting the proper treatment, that yes. you can have an 80% survival rate.
Right. And with that early diagnosis, the routine screening tests are available. Can you walk us through some of those that are available in the public health system?
Yes, so for the common cancers that we've been really working on addressing breast cancer, so mammography is recommended as a screening method, yes. primary screening method. We also do clinical breast examinations as well, right. For women. And for men, we do the PSA, that's the prostate specific antigen, which is a blood test. And we also do what we call the digital rectal exam, and that's when we examine the male through their rectum. So, you know, not a popular
yes, not very approach, popular with the men.
You do need to do both,
but important
as a part of your preliminary screening. And for colorectal cancer, we do what we call a stool test as well, and then refer if they need to do colonoscopy. So those are our three major common cancers. And then for cervical cancer, currently we're offering the pap smear. And so these cancers, we know for sure that cervical cancer can be eliminated. Colorectal cancer, you can detect it early before you actually even have cancer. And certainly for breast cancer, we can detect it before you actually have symptoms. And so that's where we want to do what we want to do. And so also for prostate cancer. So one of the first steps that we recommend for patients, because now we're taking a holistic approach, we take what we call a life course approach. So we look at your age and at what stage and what are some of your risks and what are some of the tests you need to do. We do the same thing as it relates to cancer as well.
Right, for both men and women.
For both men and women. And most importantly is that you have routine checks, health checks. And in that conversation with your doctor, you should be asking, you know, what is my risk?
Right.
And you look at the risk. So you have to look at other things like their family history, genetics, to see whether, okay, are you high risk? So if you're high risk, the screening conversation is different. The test that you'll need to do and when you need to start will be different.
It's a matter of when, not if.
Yes, your routine test. No, if you're at average risk, your screening conversation is going to be different. So you may be doing the routine age group. So, you know, for men, recommend screening for prostate cancer at age 40.
Right.
So you really need to have that conversation to assess your risk to see if there's any additional risk that would put you in a high risk group in order for you to get screened.
Right.
But we know many of our cancers that people have, they have none of the common risk factors that we are aware of that actually get cancer. And of course, lung cancer, which is common in men, we know primarily one of the major contributors is smoking. And so, of course, you know, we have our smoke-free laws in place, or tobacco legislation that helps to protect people from the effects of secondhand smoke. But also, if persons want to quit, we also have our National Council on Drug Abuse, who you can contact to help
get
you
that
through
kind
that
of
process. Support, and also at our health centers as well.
So several cancers that are very, what we'd say, I don't want to use popular, but we're seeing high incident rates here in Jamaica. You've mentioned breast cancer, colon cancer, and others. But along with that, a slew of resources are available inside of the public health sector. I wonder, Dr. Davidson, what is the uptake like? Because we have this important message that early detection is key. Early detection saves lives. What has the take-up been like, even especially with some of the programs of the ministry, Know Your Numbers and so on? What are you seeing in the population in terms of the take-up?
Yes, so for screening for cancer, it has not been adequate. The highest level we have had in terms of screening coverage is for cervical cancer. And with that, we have actually seen a decline in deaths related to cervical cancer.
Okay.
While cervical cancer is the second leading in terms of cancer death, it's not in the top three. It's third for women, in terms of cancer incidence. So it has been surpassed by uterus cancer. So even though we have seen a decline and a steady decline in deaths and also incidence, because, you know, coverage rates can go as high as 60% for a little over 60% for persons within the reproductive age group or target group. And we know that just screening even once in your lifetime can really significantly reduce your risk. It is still inadequate because we know that this is a cancer we can eliminate. And what does that mean? We get it down to what we call an incidence rate. So of 4 per 100,000 women. So every 4, you only have cervical cancer occurring in less than 4 in every 100,000 women that are alive. So we know we can do that through vaccination. So vaccination for HPV in our school children is critical and is essential in us now talking about cervical cancer as something in the past, like we have done for malaria and like recently we have done for the mother-to-child transmission of both syphilis and HIV. So we can get there with the vaccination. So we're saying at least we want to have a 90% coverage in vaccination, a 70% coverage, screening coverage, right? And also we want to at least have 90% of those who we identify. And you know, with cervical cancer, you can actually detect the precancerous lesions, changes that take place before you actually get cancer.
Right.
And you can actually treat that. So persons don't have to die from cervical cancer.
Yes, so the resources are there, the tools are there. We have the screening tests, we have vaccines, and we need more Jamaicans to come in.
Yes, yes. Certainly for breast cancer, we have seen over a 10-year period a 68% increase in death due to breast cancer. And we know if you come in early, get detected early, and our screening rates are very low. They're less than 20% for mammography. That's very low. And we know with screening rates are low for our men as well. And this is based on studies that we have done through our health and lifestyle survey.
Right.
So with all this effort we've been doing in educating persons, working along with our partners, because we cannot do this alone. It has to be through every single Jamaican that's out there to share the message, to arrange the workplaces, to arrange screening events, to facilitate their employees accessing these routine tests.
Yes.
Because basically this investment is an investment in the workforce of Jamaica and our future.
Right.
Because losing a mother, losing a father, that leaves our children vulnerable to other health issues and problems.
Right.
And so we want to ensure that we have a productive Jamaica and healthy Jamaica.
And that certainly is the message. Healthy lives, healthy people. We want all Jamaicans to be healthy. I want to just touch, as we're wrapping up, Doc, what the ministry has been doing in terms of taking this accessible and affordable screening service to the population.
Yes, so we have developed a standard for screening all over Jamaica as to what you should do for screening. We've been doing training and capacity building. We have been also encouraging persons to come to our health facility or to go to their private doctors as well. So we've collaborated with other stakeholders to promote screening in their setting. Through collaboration with the Cancer Society, every month, you know, whatever cancer month that is the focus, they have also been promoting screening and sharing that information. There are many cancer survivor groups. We've been working as well with putting out educational messaging and supporting that process, because you know, we want to make sure that we not only in our health facility we're offering the services, but also in the private setting that persons can access that service. So one critical thing is that the National Health Fund covers drugs for common cancers, and they've added to that whole suite recently. And in addition to that, they're now covering the cost for pap smears, they're covering the cost to get screening for prostate cancer, which these are the two common cancers, right? Cervical cancer, prostate cancer. They're now covering that cost in the not only for the public setting but also in the private setting. So your general practitioner, whoever your private doctor is, once you have an NHF card, so you just need to register for that. They're registered with NHF. You can go there and you can get a discount on those tests. And
it's so interesting that you brought that forward, because our guest, Kediesha, she talked about the tremendous support that she has received through the National Health Fund, having been able to still accessing her medication through the National Health Fund. So I am delighted to hear of the slew of activities from the Ministry of Health and Wellness, the funding support that is there, the information, the material, the standards for screening. And it's just a key message that we're leaving with the population, that prevention is possible even with early detection. So as we're wrapping up, Dr. Davidson, just one liner from you to our audience in terms of accessing our screening services in the public health system.
So the opportunity is there with you. Treat yourself, either do your next birthday present, your next Christmas present, saving bit by bit. We cover the costs in the public sector for those that you may have to invest in and pay as well for some of those tests. We say treat yourself to this. This is not just for you, for your family. Treat yourself to getting your screening test. And I would say know your status, know your numbers. We say that. We can't overemphasize that. But not just knowing it, but also doing something about it. So, visit your doctor. I think the first step you can do is visit your doctor and ask, what is my risk? What are the tests I need to do? Come to us in a public setting. If you choose to go in a private setting, just ask that question of your doctor.
Yes.
And look at some of your risk and some of the tests that you need to do, including for those specifically looking at cancer screening.
And that is an excellent note on which to wrap up our interview. Dr. Davidson, I'm so thankful for the opportunity to talk with you about this very important, this major national health issue, the matter of our rising cancer cases and the fact that we do have resources that are available. So that is all the time that we have for this episode of The Wellness Beat, and we've been covering cancer screening, prevention and detection. It's been a pleasure to have you here with us. We hope that you'll stay tuned for the next episode. Thanks for watching.